Hi, my name is Eleanor Zachariah, and this is my evidence-based practice project on pressure ulcer prevention in hospitalized patients. The purpose of this project is to focus on prevention of pressure ulcers in the hospitalized patient. The desired outcome of this study is the prevention and elimination of hospital-acquired pressure ulcers. The setting of this project is Mercy Hospital, Buffalo, based off the hospital safety scores reported. According to the hospital safety grade website, Mercy Hospital is performing below average for bed sores with a reported rate of 0.32. The numerical data provided is a representation of the number of times patients presented with pressure sores for each 1,000 patients who are discharged. Studies have been conducted to prove that pressure ulcers may be prevented. This project focuses on the research and evaluation of these studies to reveal best practice. The clinical question is presented in PICO format, with PE being the prevention of pressure ulcers in hospitalized patients at Mercy Hospital, Buffalo. I would be the implementation of a policy where the RN is required to follow a strict pressure ulcer risk assessment. Based on the results, the RN will implement pressure ulcer prevention strategies, including use of foam dressings, foam wedges, waffle cushions, turning and positioning, foam boots, and specialty mattresses. C would be no pressure ulcer and prevention measure in place. The outcome of this project is to reduce the number of hospital-acquired pressure ulcers in patients on each unit in the hospital to 0%. To begin the search process, the UB Library database was accessed. The Cumulative Index to Nursing and Allied Health Literature, or CINAL, and Nursing Reference Center were used to extract appropriate resources for the PICO question. The keywords used to generate search results were pressure ulcers when using the CINAL database. Inclusion criteria included was evidence-based practice, research article, English language, and between the years of 2013 and 2018. When accessing the Nursing Reference Center database, the key phrase used to produce results was pressure ulcer prevention, with inclusion criteria being evidence-based practice sheets, research article, and between 2013 and 2018. Exclusion criteria that was used for both searches on the databases was levels of evidence between 1 and 3. Initially, 463 citations were retrieved from the CINAL database, but only 2 citations were used after critical analysis of the research results to find research that was between level 1 and 3 and fit the PICO question used to guide the project. Using the Nursing Reference Center database, 17 citations were retrieved, but only 2 citations were used for this report. Articles were eliminated due to irrelevancy or having level of evidence that was greater than 3. After completion of the evidence-based search process, articles were further reviewed for relevance. A table of evidence was created shown in Table 2 on the poster. To guide the data extraction process, the following questions were used. What type of population was included? What type of care setting was the study conducted in? Is the study biased? What research design was used? What is the sample size? As the data retrieved continued to be further analyzed, similarities are seen between the citations. Similarities that were noticed include the use of specialty equipment, risk assessment tools, and turning and positioning schedules. Recommendations based on the evidence is as follows. Padding on the hospital beds should only be used for those who are incontinent. Padding should be cloth material and changed promptly, while diapers should be eliminated. The rationale for this recommendation is that the use of diapers holds moisture and heat close to a patient's skin, allowing for increased chances of skin breakdown and pressure injury. The use of foam wedges, waffle cushions, and foam boots are recommended for patients in the hospital. The rationale for this recommendation is to offload pressure on at-risk prominences to decrease the prevalence of pressure injury. Recommendation to prevent pressure ulcers based on evidence is the use of an approved assessment scale such as the Braden scale. The rationale for this recommendation is to promptly assess a patient's risk for the development of pressure ulcers. Once the assessment is made, the care provider should act upon the risk as presented by a policy and/or protocol. To implement a new protocol, it is important to have a solid foundation of research and evidence to support the change in formation. Through the research process, it is possible to locate the appropriate evidence needed to form a new policy. Formation of a protocol in a hospital requires the approval from many different parts of administration. One of these parts of administration includes the IRB. They are required to review and approve any projects related to human subjects. This project involves human subjects, in this case they are patients, which would require IRB approval before continuation of the project. Once the protocol is formed, it must be implemented in the proposed setting. To introduce the project to the staff involved, a well-written and thought-out plan of action must be created. This can be in the form of a pamphlet, poster, or online education module to inform the staff of the policy change and the evidence to support the reason for change. Education that will be required is the attendance of classes annually to teach the staff different stages of pressure injuries, risk assessment, and the prevention strategies that may be implemented. Nursing staff must be educated on the proper assessment of patients to determine their risk of development, and a protocol must be in place for staff to follow based on the assessment they perform. New equipment that will be required to proceed with the implementation of pressure ulcer prevention and treatment includes, but is not limited to, foam wedges, foam dressings, specialty mattresses, waffle cushions, and more. The equipment and supplies are a contributor to the cost of the implementation of the new pressure ulcer prevention protocol. Costs that will be also incurred, aside from equipment and supplies, is a team comprised of RNs who will be responsible for pressure ulcer prevention and staff education, called the pressure ulcer team. Costs will also be in the form of education programs for the staff and patients to ensure proper knowledge of pressure ulcers and patient risk assessment and prevention. Measuring practice change will be conducted on a unit basis. In Mercy Hospital, there are 12 units that will be monitored for hospital-acquired pressure ulcers and are as followed. Operating room, labor and delivery or maternity, 4 north, 5 west, 5 east, 5 north center, 6 west, 6 east, 7 west, 7 east, 8 east in the ICU. Once a month, each unit will be required to undergo Prevalence Day, which will be a day designated to the evaluation of patients' skin for the presence of pressure ulcers. This will be done by the pressure ulcer team mentioned above and will require pressure ulcer forms to be filed. The pressure ulcer team must evaluate each patient's skin and document the presence of pressure ulcers that may be found. If a pressure ulcer is found, the member of the team must then search the patient's chart for the admission history and physical, or H&P. If the pressure ulcer found on the patient is not documented in the admission H&P, it will be considered hospital-acquired and will be reported. The percentage acquired from each unit every month will be the measure of success of the pressure ulcer prevention protocol in place. The goal of this protocol implementation is to decrease the number of hospital-acquired pressure ulcers to 0%. The practice change will be sustained in several ways on each unit, providing an improvement of the hospital-acquired pressure ulcers scores hospital-wide. Practice will be sustained through strict nursing education. Nurses will be required to pass a competency both online and through peer review annually. Nurses must complete a total of 10 hours of pressure ulcer training upon hire and must participate in at least 5 hours of training yearly. Training will include the correct identification of pressure ulcer stages, use of pressure ulcer risk assessments, as well as implementation of appropriate prevention measures. The pressure ulcer team will have representatives available for both day and night shift and can be paid for education or patient skin evaluation on an as-needed basis. Pressure ulcer statistics for the hospital and each individual unit will be made available to all staff, as well as educational posters in break rooms and medication rooms. Enforcement of this policy will be the responsibility of the pressure ulcer team, unit managers, and nursing staff. This concludes my project, and I hope you enjoyed. Thank you.